COPD or chronic obstructive pulmonary disease or lung disease. It is very important to know about the COPD or asthma because in the winter usually we see a lot of patients coming to the emergency department with shortness of breath. So what are the symptoms? The most common symptom of COPD and asthma is shortness of breath. Shortness of breath and exertional dyspnea. Both are the symptoms of COPD. Patient may have low oxygen saturation. These are the most common symptoms of COPD and asthma. So whenever patient comes to us in the emergency, what we do, we check the chest of the patient and you can see there is spasm in the bronch of the lung. So we nebulize the patient, we give the steroids sometimes and we try to relax the soft muscles of the bronch, which actually are the culprit for the COPD and asthma. If a patient is labeled as COPD or asthma, how can you prevent yourself for going to the hospitals? So usually the trigger point of COPD and asthma is cold. So avoid the cold exposure, one. Number two, avoid the smoke, avoid the pollution, avoid the smoking, and avoid any risk factor which triggers the shortness of breath. You have to be very cautious so that it cannot lead to the hospitalization.
Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.